All right. Welcome, everybody, to the Maine Rural Healthcare Education Grand Rounds. My name is Dave McClellan. I'm the program manager for the Merge Collaborative. This series is hosted by the Merge Collaborative and the Building Maine project, which are both funded through the Maine State Department of Health and Human Services. We're very excited to welcome Frank Bailey today. It's presenting to us on Stay Calm, Teach On, Managing Stress While Precepting. So just tell you a little bit about Frank and his background. He's a medical educator at Northern Light Eastern Maine Medical Center in Bangor, Maine. He is a certified emotional intelligence coach through the Lynn Leadership Group. He deploys tailored emotional intelligence curricula to all learner levels throughout the healthcare organization with the goal of increasing team function to provide phenomenal patient care. He also oversees faculty development of many types of clinical preceptors and holds the position of program director for the Northern Light Health Longitudinal Integrated Curriculum. So it is great to have Frank here. I would ask everyone here, I think, knows what to do. We've turned our cameras off, which is perfect while Frank presents. I will invite everybody to turn those cameras back on when we get into the Q&A session. But from here, I will turn my camera off, and Frank, the floor is yours.
All right. Well, David, I want to thank you so much for this opportunity to be on and share with you folks. There are definitely times where stress is at a maximum. But before we delve into this, here is the Cloud CME. If you are interested in obtaining some of those CEUs, this is all the information. I know David's going to put that in the chat for folks, but just want to pause for a moment while you're all able to see that. The number and the things on here are the most important, the code as well. And also a couple of other things before we get started. So just for awareness, as far as Cloud CME, it is a pretty smooth program. I will admit it works fairly well. So these are some of the components that we have: no relevant financial relationships, and all these parts of the Merge Collaborative, or the ACCME, Maine Medical Center, all the good things. I want to pause long enough for the recording to pick it up. And I think that is the last one. Yeah, excellent. So when I was approached about sharing with folks, it's always kind of a, what in the world do I focus on? How do we kind of target this? And at the forefront of my mind, as far as rural preceptors go, you folks are busy. There's a lot going on. Productivity is ramping up. Staff, we're losing folks all across the nation, but especially hits hard in rural locations. And we're trying to determine how we can incorporate learners into the fold. And it's almost like this is an incredible ask sometimes. And that stress, it's not just perception. There are some very real things going on. The good news, though, there are very real, tangible ways to counter that. So as we go through today, I want to encourage you folks to kind of treat this like Burger King. Have it your way. Take what little bits and pieces might work for you. I'm going to present a wide swath of many different things, and you might look at it and say, I tried that before. It really doesn't work. I'm not going to take offense. So there are many components that I've heard folks use. I'll share some stories. I'll ask some of you all for your experiences. But we want to kind of take a look at the different components of emotional intelligence. Sometimes they call them competencies. I shy away from that because you all already have these. It's just using them intentionally. Self-awareness, what am I thinking and feeling? Self-regulation, how am I displaying that? That's body language, tone, motivation, empathy, social skills, relationship management, all of those types of things. It impacts precepting. It impacts clinical practice, how we interact with one another. And if we do so intentionally, we can direct our intentions. We can direct our behaviors and our strategies to positive interactions as much as depends on us. And there's something called the SBI model that I'm going to share with you folks. There are many models out there, and sometimes they work, sometimes they don't. I was talking with Dr. Newman, who's one of the folks at Acadia the other day, and he said, knowing the model, knowing the framework is one thing, doing that in practice are 5 different things. And I said, oh, that's fair enough. And then figuring out what is your personal approach to managing stress. How do you keep the learners engaged with the clinical workflow and not tank your clinic schedule? That's kind of an important thing. So a lot of suggestions today, a lot of ideas, but definitely want to share with you folks some of the things that I had that I've gleaned over the last decade of working at Northern Light Health. So like I had said, these are the key components of emotional intelligence. And I kind of prescribe to Daniel Goleman's model. There are other models out there, and they're wonderful, and I'm sure they're applicable in some way. But for what I've found, we need something short, something brief, something that we can use. So self-awareness, what am I thinking and feeling? Self-regulation, how am I displaying that? Body language and tone. Self-motivation, how do I, what are my needs? What are my wants? What drives me? What are my desires? How do I get that work-life synergy? And then others' awareness. What are they thinking and feeling? And we know that by their body language and their tone. So many of the self-awareness things, we can use those to kind of glean and scan others and say, okay, I believe that they're feeling this, they're thinking this. And then how are we going to manage that relationship? Most of the time, we think globally. How am I going to overall direct this towards a path that we're trying to get to? But I would share and posit that we want to look at that interaction. How am I going to deal with that interaction, that relationship? How am I going to manage that in that moment? Trying to think of globally moving things, it's a glacial pace. There's a lot to that. It's stressful. But in this one moment, what can I do to direct my intentions to live authentically to what I'm trying to do? If it's to see patients and provide that care, how does that work with the learners? If it's to really educate, mentor, and guide, how does that work with a busy patient schedule? So there's some benefits there and some things that can work synergistically. So if we are working intentionally with these emotional intelligence components, we're going to have improved communication, enhanced patient care. There's a better work life. I know work-life balance is there, but work-life synergy. I'm assuming that you folks are here because you want to find maybe some new stress management things, but also you're interested in education. You're interested in precepting, mentoring, guiding, and that's more of what precepting is. It's not necessarily the didactic portion, but it's the mentoring and guiding that we're really doing with these learners and modeling things. So these things are really important. They curtail communication errors. It builds mutual trust and professional respect. So as you model those behaviors for your learners, they're going to see that. They're going to see not just how you deal with the patients and how you ensure that everything is done correctly, but more so, what are the nuances? When you're doing a mini mental status exam, there's a lot of nuance to that. I recall there are med students that we're sending out on home visits that said, I'm going to do the PHQ-9. And we paused for a moment and said, what does that look like for you? And they said, it's just questions. I'm just going to, no, that's very conversational. There are nuances there. How about we let the social worker kind of take the lead, and you can kind of watch and let us know what you think, and we'll debrief. And then maybe you could try it on the next time around. So there's a lot of nuance to these interactions, doorknob confessions being some of those things. Somebody comes in for smoking cessation, and on the way out, they say, I'm not sure that my child is my own. There are many things that I've heard over the years that I'm absolutely floored and how important these components are in every single interaction for learners to pick those up. If we think about the physician's competency reference set, number 8 in that is all emotional intelligence, self-awareness, know when to get help. So you folks are modeling these behaviors for your learners. So when we think about some of the situations that we have, and I have the luxury of doing all the things educational. I don't have to see patients. That's what you all get to do. I get to work with learners from pre-med all the way up through attendings. But what are some situations that make you feel stressed when you're working with learners? I'm curious. You can either throw it in the chat or you can unmute.
Folks are also welcome to turn their cameras on too if they're jumping in with some ideas. And if it goes in the chat, I'll read it out loud so that the video watchers have a chance to see it. So let's see, we have that, the feedback. So Denise White says, feedback can be very stressful.
No, I most certainly do not always recognize when I feel stressed. That's part of the problem.
Yeah. Okay.
Amanda, did you have anything? No? Okay. Very good.
All right. So hopefully we'll address some of these. Yeah, you don't always recognize when we're stressed because we kind of put that away. We pack that away and we're like, well, we'll deal with that later, but later never comes. And the more that we continue in that pattern, it turns into a pattern of behavior. And then it becomes a method of operation. And hopefully there are some things here today that I share with you folks that you can kind of break those patterns a little bit and kind of get that to come back online as you become aware of those things.
Frank, I'll note some other comments came through that I just didn't notice right away, but just some other ones where Tom Gearin said running behind schedule can cause stress. Nate Donald said balancing patient needs with resident educational needs.
Absolutely.
And Jim Jarvis worrying they might ask questions where I don't know the answer. Great feedback, folks.
Yeah. And so a lot of this, what I'm seeing in here, and there is feedback, how to give feedback. And I'll kind of take these one at a time as we go through these. The RHYME method of evaluation, reporter, interpreter, manager, educator, that's a great framework for giving feedback. So telling your learner ahead of time, hey, I use RHYME, and this is, when I give you this feedback, this is what it means. So setting those expectations ahead of time is really a core part to this. If you are running behind schedule, letting them know, if I get backed up, we're gonna shift and do things differently, and we'll talk a little bit more about that today. And then thinking about the patient needs versus educational needs, directing them to resources, directing them to some of those self-learning opportunities using a framework called the Master Adaptive Learner. I've been working with the psychiatry residency at Acadia, and using that framework of the Master Adaptive Learner in tandem with the 1-minute preceptor and RHYME and the BID model. And we'll later see the model today that I'm going to present. There are a number of ways that you can kind of build on that framework. And then as far as if they ask a question you don't know, that's a wonderful teaching opportunity to direct them to, if I don't know this is where I go. And now you've given them a life skill that they can take with them. But getting back to this self-awareness, one of the things that you can do when you feel stressed, and I want to really, really emphatically state it's important to say that you are feeling stressed, not I am stressed, because that's like, that makes me think of Lightning McQueen. Speed, I am speed. He's preparing himself for that race, and he gets in that mindset of this is what I am. And so then he can perform. If we think about when we're going into the clinic, stress, I am stress. That's how we're going to perform. So number one, changing how we talk about that, I am feeling stress. You could do something about that. Well, why am I feeling this? Why am I thinking this? And dig into that a little bit more. That kind of sets it outside of, this is my identity. This is who I am. And starting with something as simple as that, looking at our body awareness. Am I feeling that tension in my shoulders? Am I doing pacifying behaviors? If you think of a baby when they're stressed and they cry, we pat their back, we rub their back, shh, it's okay. We still do that as adults, and those are called pacifying behaviors. So if you notice my palms are sweaty, or I don't know, boy, let me think about that, those are all pacifying behaviors. Those are signs that we're stressed. I worked with one individual, they had a ring that one of their grandparents gave them, and they would twirl that ring until smoke came off of it. They would relive that stress. So figuring out what your tell is. When you're stressed, where do you feel that? Where is that coming in on screen? Is it you begin to kind of close down, your shoulders begin to shrug up, your feet are doing the river dance, you want to get out of there? Scan yourself, scan your own body, and think about, is my respiration rate getting shallow? Is my heart rate speeding up? Am I feeling all these things? That's the emotional hijack. That's the fight, flight, or freeze mechanism. Now, it can be small. It can be grand. It depends on the level of stress you're experiencing. If there's more stress, your bandwidth decreases. So being aware of some of those things. There's also a component called the 6 human needs. There's certainty, variety, significance, connection, growth, and contribution. And if any of those aren't met, we can be prone to the emotional hijack. Now, I'll share something to offset that emotional hijack in just a little bit, but we're going to continue on. So if you scan your body and you go, oh my goodness, I'm emotionally hijacked, or I'm feeling stress, then you can, that's the first step, that self-awareness. Okay, now what can I do about that? Also, emotional awareness. If your mood changes suddenly, or you're irritable more than normal, or you're frustrated more than normal, you can ask yourself, what am I feeling right now, and why? And saying that out loud. Now, obviously, you don't want to do this in front of certain folks, but saying it out loud makes it tangible. It begins to externalize that. And you could say, what am I feeling right now? I am feeling stressed. Why? And you can begin to verbalize those things, and it helps with that awareness. Also, cognitive awareness, recognizing is this thought patterns, this self-talk. We have a narrative going on in our minds at all times. And that self-talk, if you compile that and you notice patterns in that, you begin to notice a kind of a voice. There's a famine voice. There's a the world's coming to an end voice. There's some catastrophizing that can go on there. So if you notice that catastrophizing or excessive self-criticism, look out for those repetitive thoughts that are combining into voices like, I don't have time for this. I know that's one of mine. I don't have time for this right now. And when I say that, and oftentimes it is out loud and not in front of the person, it's afterwards, oh, I don't have time for this. Why? What am I feeling right now? I'm feeling that pressure, and why? Well, usually for me, it's self-imposed. I'm putting in Dr. Jarvis has told me, Frank, this doesn't need to be done today. Those are the things we have to ask ourselves. How often are we putting that pressure on ourselves versus what is really needed right now? And then feedback from others. You have to have those that you trust, that you can lock into. And if they come to you and they say, you seem really rushed today, or you seem like you're on edge, try not to shrug that off, and try to consider, maybe they're right. Maybe I am rushed, and that's okay. If that's what you're feeling, it doesn't negate your feelings at all, but that's a really good way to cue into, so I'm feeling all these things in my body. I have recognized these emotions. I'm aware of my self-talk. Other folks are saying this. Okay. So now I am feeling stressed. You lock that in. That's the first step. The next is thinking about what can you do during the time of the day. This is more of a self-regulation type of thing. How are we going to stay calm? How are we going to stay focused in these high stress environments? And some brief mindfulness, 30-second breathing exercises, delegating tasks even to empower learners. There's a different thought. There's some value add things that you can do with learners. Have them chart. There's verbiage that CMS has put out that we can use, verified key findings, taking vitals, rooming the patient, even working with other healthcare professionals. Interprofessional work is immensely valuable. So giving those opportunities and allowing the learner to be value add is really going to bolster their ability to become a self-directed learner. And so guiding them in that is a really great way to give yourself a little bit of time to potentially catch up. One of the things that is ideal is you go in and see the patient, the learner goes in and sees the patient, 20 minutes later you come out and then go see the learner's patient with them and verify all the things, do the 1-minute preceptor, rhyme, whatever other framework you like to use, come back out, you go see another patient, and they finish up with that patient. If you do 3 in the morning, 3 in the afternoon, that's 6 interactions that they've had. And hopefully that doesn't tank your clinic schedule. Things always get delayed. Schedules always run behind. And the clinical environment is seriously stressful. So best intentions are just that until we are able to actionalize that. And so there's a lot of things that kind of get in the way of our intentions. And when we think about that, how we're managing our time, how we're managing our energy, some of these things are really important to set expectations at the beginning of the day before we're in that stressful situation. So here's some things that you can take. You can use them. You can discard them, whatever you would prefer. I know there's not a cookie cutter approach to all these things of managing stress. Some things you may look at and go, that doesn't work for me. And I will honestly share, I've used each of these at different points. Now, some of these work better than others for me because that I have my own worldview, I have my own experiences. But try these out. I'd encourage you folks to just kind of give it a shot. Some of the deep breathing things, inhale for 4 seconds, exhale, hold for 4 seconds, exhale for 6, repeat 3 to 5 times. That was something I had never used up until last summer. I was driving back from Jacksonville. We had evacuated for Hurricane Helene, and I wasn't sure we had a house to come back to. And full disclosure, I had to just remind myself to breathe on the 2-hour drive home several times. It wasn't a one and done. It was repeated over and over and over. So when you're experiencing that stress and that stress is persisting, you're feeling that and it's real, you're going to have to do this over and over. It's not a one and done. So some of the deep breathing, we're really trying to activate the parasympathetic nervous system and reduce that stress. Now, good news, we got home and everything was fine. Had like a shingle or two that was off. So incredibly fortunate. And especially seeing some of the things as we drove into town, that stress continued to rise, seeing trees down and on houses. Another thing is a grounding technique. This one works great. In fact, they do this over in Japan quite a bit. The 5, 4, 3, 2, 1 method. This one is, practice it a little bit outside of the stress. That way, when you get into it, you'll kind of go, okay, I know what to do here. 5 things you see, 4 things you hear, 3 you feel, 2 you smell, and 1 you taste. Now, this takes a little bit more time than the deep breathing, but it really redirects the focus from the stress to the present moment. And so this is something to kind of offset that. Then we have mental strategies. Reframing your thoughts, and that's that whole thing of I am feeling stressed. Also thinking about this is overwhelming, that global approach. Yeah, all of it is overwhelming, as opposed to I'm going to handle this one thing right now. This is what I'm doing right now. And that's something I've shared with folks. There was one individual that was really struggling with balancing everything and studying for step 3. And I said, what is the biggest challenge? And they said, just being able to stop everything going on in my mind that I have to do and focus on what's in front of me. Okay, so tell yourself out loud, this is what I'm doing now. I personally, I write everything down and make a list at the beginning of the day. Before anything starts, I sit down, I write my list, and as things happen, and I prioritize them. That's the pause and plan. Beginning of the day, I prioritize, I figure those things out, and as the day unfolds, I have that all written down. I'm not trying to mentally go back and rethink things. So I've prioritized my tasks. Now, there are days where one thing may get done on that list and other things take precedence. That's okay, but I still have that. And you can do this in a number of ways. It could be a ABC. A is on fire, B is smoldering, C is it's kind of in the background. Or you could use the Eisenhower box. That's the urgent and important, not urgent, but important, not urgent, not important, but urgent, and then not urgent or not important. That's a great way to categorize things as well. If it's urgent and important, do it now. So you can kind of look at that. So whatever works for you, whether it's ABC or the Eisenhower box, either way, but mentally prioritizing those tasks. And then ask the learner, what's on your list for today? That way you get an idea. If they have no expectations, okay, well, tomorrow when you come in, you need to make a list. What do you want to learn? And that's part of encouraging them to be self-directed. So it helps you regain control if you pause and plan a little bit. Micro breaks. These are super important. And I will fully confess, I can get locked into something and that laser focus, and next thing I know, 4 hours have gone by. Completely missed lunch. I'm right in the midst of how do we turn normative evaluations into competency-based evaluations, something I absolutely love, which I know is odd. But taking 30 seconds to stand, to stretch, to step away from things, it's very important. Now, if you're going from room to room to room, you may need to take 30 seconds to step away from that, take a breath, do some deep breathing, and then come back to that. That gives you a little bit of that control over the situation, bringing that back to center. Also, delegating things to learners. Part of this requires that you've already taught them some things, that they would know how you want it done. So you're modeling the different components, and you can do that with a 1-minute preceptor. As you get a commitment and you get them to share their rationale, teaching general rules. This is something that you've done. They've seen you do this, and you're reminding them. Reinforce what was done right. You can say, hey, remember when we did this before? You saw me work with this patient. You can tap back into that. There's nothing wrong with that. So modeling, they are watching all the time. They're looking at all the different components. So whatever you can delegate to your learner, go ahead. Turn that stress into a teaching moment, like preparing patient charts, things like that. And so when we feel that emotional hijack coming on, if these things are not working, that emotional hijack, that fight, flight, or freeze response, that your heart rate increases, your respiration rate increases, getting shallow, you may start to kind of close up, protecting your vulnerable underside, and you're closing up, and you're turning, you're dorsally venting. All these things, pacifying behaviors, are signs of the emotional hijack, the amygdala hijack. And what's happening, that amygdala is snapping the attention away from your left prefrontal cortex, that thinking part of your brain that rationalizes, that you really need when you're working with patients and learners. It's doing you a disservice. Now, this is when the perception of the situation is unsafe. Now, we don't have a saber-toothed tiger lurking around the corner. However, sometimes the schedule feels like that. And as our 6 human needs are not met, certainty, variety, significance, connection, growth, and contribution, anytime those are being trampled on or shut down or not met in a way that we would expect, we are now primed for the emotional hijack. And so the physical shift, very easy. First thing you're going to do is breathe, and not a long breath, just breathe. So the first thing is nice deep breath. If you have to do 2 in through the nose and 1 out through the mouth, that also is a quick way to snap that parasympathetic response. So the second thing you're going to do is physically shift. Now, if you have hair, you can do something with that. I don't, so I use my glasses. It could be a tie. Whatever you're doing, it has to be something you can do in front of other folks. So adjusting a badge, tie, glasses, whatever that might be. And the third thing, this is a twofer, that's interesting. Why do you say that? Or why do you feel that way? Or why do I feel this way? So this is what it looks like. Start to feel that emotional hijack. The moment I recognize that, did my self-scan, I'm emotionally hijacked. And it could be little, could be grand. This is what it looks like. That's interesting. Why do I feel this way? Why am I thinking that? And it's a very calm, and it snaps everything back in line. So what you're doing, you're bringing oxygen back to the left prefrontal cortex, that thinking part of your brain. You're snapping that attention away from the amygdala. By moving, you're breaking that kinesthetic lockup. You're giving some feedback to your body that, no, I'm not going to continue in this stress state. I'm going to break that apart. I'm going to do something different, give some biofeedback. And that mantra, that thing, that phrase, that's interesting, that's something you have to think about. What was I supposed to say? Oh yeah, left prefrontal cortex engage. Now the other part is, that's interesting. Why am I feeling this way? Or why am I thinking that? Well, now you've displayed some significance that what I'm thinking, what I'm feeling, it's important right now. It's a part of being able to function. If there's a point where I can't function, I can't serve my learners. I can't make sure my patients' needs are getting met. So if I'm not able to do the things, then I need to kind of figure out, okay, what is going on here? Am I uncertain about things? Is there too much variety in the schedule? Am I feeling disconnected? Sometimes the stress, that will make us feel disconnected from things. That it's just, here we go, it's the meat grinder. Maybe there's too much growth required, no contribution into what's going on. It's just one after another after another. These things can happen very easily. So the emotional hijack is real. So try the physical shift. It also, if you're working with someone else and you can see that they are emotionally hijacked, that's interesting. Why do you say that? That's significance, that gives contribution. So you're fueling their 6 human needs. So it's not just for you. You can also use that for others. And so as we think about the communication strategies, we want to be transparent. Setting the expectations early on in the day. And you could say, hey, this schedule today looks just absolutely wild. So if I get into a place where I need to be laser focused, this is what it's going to look like. I remember a surgeon once told me, when we're in the OR, if I get quiet, that's when we're in trouble. So it's important to let your team know, to let your learners know, this is what's going on. If it's busy, hey, look, we're going to navigate this together, but really focus on one thing at a time. And also use humor. That's a great way, stating the obvious and just kind of offsetting that a little bit. You can also use some environmental cues. This could be calming background images on the computer, maybe a beach scene. It could be an image or a sign or a short reminder note. Breathe, you've got this. This too shall pass, or today is a good day, or not my circus, not my monkeys. Whatever you want to use, totally up to you, just some visual thing. And then teaching learners through stress management. You are modeling things, and whether you realize it or not, they're watching you. They really are. They're trying to see, how do you deal with this? How do you handle this? It's not just the medical knowledge. It's not just the patient care. It's how do you do the interpersonal interactions, especially when it's stressful. So sometimes we think if I don't show any kind of exterior sign that they're stressed, that's what I need to do, right? No. It takes strength to be vulnerable. It takes strength to admit, I don't know, this is what I use, or I'm feeling a bit overwhelmed right now. I'm going to take a breath before we continue. That helps them to learn, oh yeah, self-care is a thing. It isn't just a thing we did in basic science. We actually do use this, and there are things that we can employ, and it helps them to be grounded as well, to realize that you folks, as the seasoned professionals that really get it, that deal with things, they can see that these are real things that they can do while they have a busy clinic schedule. So we're going to stop here for a moment, and I'm going to put this out to you folks. If you have a third-year med student, and this is a real thing, I have sessions with them quarterly, they'll say, I can't do this. I am totally messing this up. It's usually in the first half of the year. About January, they start thinking like an attending. At least solid interpreters. But if they can't keep up, they're making mistakes, how would you respond to this? Anybody want to take a whack at this? What do you say to a third-year med student that if they feel like they're just not able to keep up? Feel free
I'll
to
monitor the chat, folks. If you want to put it in the chat, I'm happy to read it out. Go ahead, Tom.
I think normalizing it, just recognizing that we, all of us that have gone through the process of, education go through that, and just, reassurance that it's normal.
Awesome. Yeah. And they get to see you, someone who's successful, in dealing with those things. All right. So there's a couple of things that you could do. Number one, recognize the emotion, and normalizing that. It's understandable that you're feeling frustrated. And we were there, and using that empathy to validate. Absolutely. It's a tough environment. It's common to feel overwhelmed. And then figuring out, well, why? Because this is kind of a real global statement. Can you tell me more about what's challenging, what's difficult, what exactly is causing the heartburn, and then offering that support? You're here to learn. And that's what I tell third-year med students as they're starting out. And even PGY1, the first-year residents, you're starting out. You're going to make mistakes. Let's think about one area we could focus on. And that really could be the start of something you could do for the day. This is the one area we're going to focus on. We're going to work on your skill set. We're going to work on patient management. We're going to work on whatever it might be, and giving them very clear direction. And so you could say, for the next patient, why don't we work together on just this one part of the visit, and you take the history. We'll go step by step. And so pull back and kind of shift. You use rhyme in that. Tell them, hey, you're telling me the what, you're telling me the why. I want you to focus on the how. How are you going to manage this patient case? And so we think through those things. We can use something called the SBI model. We're really trying to engage learners without adding to our workload. And this is the relationship management. Having opportunities for patient interaction is incredibly valuable. It doesn't mean that you have to give didactics at every moment of the day. If they're able to see a patient on their own, get the history, do the physical exam, come out, present their findings, they're at that interpreter level, great. What are some other things they could do that's value add? Then, you can work through some of the suggestions. Yes. Oh, you're on mute.
I really commend you for saying that. I think that that's in some ways people feel like I need to be teaching nonstop. I need to be giving formalized lectures. And what I tell people, and sometimes to senior residents, talk out loud. Tell what you're thinking out loud. So you're doing the thinking anyways.
Right.
And so I'm glad you mentioned that. It doesn't have to be formal lectures.
Yeah, I mean, who has time to sit down and compose formal lectures in a day? And besides that, you think about in our culture and our society right now, we have so much. There are so many movies to watch that you can't watch them all. There's so many books to read that you can't read them all. There's so many resources to use, you can't use them all. So when you think about, especially Gen Z, as they come through, they're very shrewd with their time. It's what is my return on investment? They're going to find the most bang for their buck. And they're really good. We can learn a lot from them. I can learn a lot from them. Not everything is expedient. And so what is the most beneficial? Me sitting there and just pouring in content and lecturing, that's not beneficial. They can go to UpToDate and watch a video on 2x speed and get all the highlights. They can even use AI to summarize some of those things. And I know AI is a little contentious, but there's a place for it. And we can really become more efficient. And they are efficient learning machines. It is incredible what they bring to the table. So didactics, unless that's something that's fulfilling to you, and then find a time and a place to do that and reason through those and really kind of dig Socratically into what are you thinking here? If you have the time, great. But don't feel that pressure, especially with a busy clinic schedule. And so when we're thinking about the rapport, I'm sure you folks sit down, you get to know them, what drives you, what do you want to do? What are you interested in? When you're doing that, tell them, I'm going to give you some difficult feedback throughout the course of this. And maybe times where I have you step back. This is the process of bringing you from good to great. Don't take it personally. It might feel like I give you some hard feedback. That's because I want to see you succeed. And part of that is growing, and growth isn't always easy. So I'm going to bring you from good to great. And when you do that, when you preface that, that allows that feedback. So if you give them a really difficult thing to hear, it's okay. I'm trying to get you from good to great. I'm trying to get you to become an attending. At the end of third year, they're not ready for residency, but they're that much closer. And it's by the efforts that you folks put in. So whatever that looks like, they don't always have to understand every part of it, but they have to trust you. You have to have that rapport. So then we have the SBI model, and hopefully this is something that's expedient for you folks. That's the situation, behavior, and impact. So you can use this with a 1-minute preceptor, and you can use rhyme as well. There's a lot of different things in this that's very rich, but it gets to, this is what you did. This is the kind of the facts behind it. It's very fact-based. It doesn't tell them you frustrated me or you're a horrible person. It's just, this is what you did. During this patient presentation, you gave me a lot. You gave me too much. And you missed some really important things. And because of that, it made it harder and it delayed things. So we're going to try to make sure that we don't do that next time. And here's the way that we can shift that. So this isn't uncommon. Learners at this stage, they're trying to figure out what's extraneous, what's important, how do I get all this together? And that's just a subjective objective. That's not even assessment and plan. So if you notice someone is struggling with this, there are actual tools that you can give them to go do on their own. One is highlighter. It's going back through and look at semantic qualifiers that make that diagnosis. So sharp, dull, right, left, sudden, delayed, any of those types of things, they can print out the chart and go back through and highlight those things. Another tool that you can use is called ASOAP. Have them give the assessment first. And as they're giving the subjective objective, you can see what details confirm that. There's another thing called horizontal reading. where they can look at what are the typical features for this chief complaint. So you tell them, okay, you're going to see these certain patients today, you know, or the day before. Tomorrow, you're going to see these certain patients. I want you to read up on these things. And when you do, look at, for that chief complaint, what is the pathophysiology, the epidemiology, typical lab features, you know, other things that might be important, and they can begin to discriminate their illness script. So horizontal rating is a great thing, and they can figure out what are the top 3 things. So they're coming in for an influenza-like illness, and so what are the top 3 things? And thinking about those.
So, hey, Frank, just really quick, sorry to interrupt you. I just want to do a quick time check because we only got a couple minutes left when we hit the 45-minute mark, but I know some people will have to jump.
Yep.
I'm happy to keep the recording going because this is amazing content. I love this presentation, but I just wanted to check in with you just so people do have a time for Q&A before they hit the 45-minute mark.
Sure, absolutely. This was about where I was going to curtail that. I've included in here some things because I know we'll send the slide deck out and it will be available. Yep. So we do have some things that you can do before the day starts, setting clear expectations, reflecting on your emotional state. We kind of alluded to that earlier. During the day, interacting, providing feedback, teaching the moment. We've kind of gone through a lot of these already. And hopefully folks, as they view the video, they can go through and pause these things to kind of look at that. And then as the day ends, you know, really checking in and seeing how things went. You know, during those really stressful days, use the stress management strategies and be transparent. Let them know this is kind of where we're at and thinking about those things. So most of all, give yourself grace. Y'all have a really tough job. You do amazing things with the learners, and you're really doing some incredible work. So with that, I will stop sharing.
And I do invite folks to turn your cameras back on. Give us just a few minutes here. If anyone has any questions, thoughts, comments. I'll say my favorite part of this was the Lightning McQueen reference. Cars were a big part of my life when my children were younger, and I know that quote, and it makes perfect sense.
Yeah.
This is a nice reframing of maybe material that I had sort of known about, but not in this way. So I think the construct and framework was very helpful. Thank you so much.
Excellent. Excellent. Good.
Yeah, thank you. I think it's something that we probably don't talk about enough is the emotional experience of teaching as opposed to the technical aspect. So I really appreciated that as well.
I'm going to confess, I tried that 5, 4, 3, 2, 1 when you were explaining what that was. That's brilliant. I'd actually not heard that technique before.
Oh,
but that's lovely. Yeah, that's a very interesting way to ground yourself.
And when you do that, use 2 fingers to point.
Oh,
so that's an added. Right. Yeah. One is rude, but if you point to things as you're recognizing that, you know, I've gotten so busy to the point where during the morning I have to check things and make sure I lock the door before I leave. When I did commute, I would have to legitimately point to the door because otherwise I'd be like, did I lock the door? I can't remember. I've already started my day at 6 a.m. In my mind, it's already on fast forward.
That's great. That is great. Well, folks, thank you for joining us again this month. Before we go, let me just share what we have going on next month. It's a great presentation. Annie Durthick will be back with us. Annie is from the Central Maine Medical Center Family Medicine Residency, and her topic next month is evidence-based strategies to improve learning and how to implement them in medical education. So really about learning impact, which is pretty interesting stuff. So that is going to be on March 14th, just like this was February 14th, March 14th. It's making it easy for us. So it should be on your calendars. We really look forward to having you share it with your teams. We would love more folks to come on in. And if they can't make it, please always direct them to our website where these are listed. So Frank, thank you so much. Thank you, everybody. And we will see you next month.
Thank you.